Are you one of the millions of people worldwide who suffer from chronic kidney disease? If so, you're probably well aware that what you eat can have a huge impact on your health. But did you know that there are some fruits that you should avoid if you have kidney disease? That's right, in this video, we're going to reveal the 8 fruits that those with chronic kidney disease cannot eat. Now, you might be thinking, I've heard of high potassium foods before, but how bad could a little fruit really be? Trust us, you're going to want to pay attention to this information. Some of these fruits may surprise you, and the consequences of consuming them if you have kidney disease could be severe. So, if you want to learn which fruits to avoid if you have chronic kidney disease and why, stick around. We're going to break down the science behind each one and give you some alternative options that are safer for your kidneys. Don't let your diet unknowingly worsen your kidney health. Watch this video and take control of your nutrition today. Now, let's start our countdown with number 1. Banana. Bananas are a popular fruit that is rich in essential nutrients, such as potassium, fiber, and vitamin C. However, people with chronic kidney disease or CKD should limit their consumption of bananas as they contain high levels of potassium. When kidneys are not functioning properly, excess potassium can accumulate in the blood and cause complications, like irregular heartbeat, muscle weakness, and even cardiac arrest. A 2019 study published in the journal Nutrients found that consuming high potassium foods like bananas can increase the risk of hyperkalemia, a potentially life-threatening condition in people with CKD. Therefore, it's essential for people with CKD to monitor their potassium intake and consult with their healthcare provider or dietitian to develop a personalized nutrition plan that suits their individual needs. By limiting high potassium foods like bananas and replacing them with low potassium alternatives, people with CKD can manage their condition and prevent potential complications. Next, number 2, avocado. Avocado is a popular fruit known for its unique taste and various health benefits. However, it is not recommended to consume if you have chronic kidney disease. The reason behind this is that avocados are rich in potassium, which is a mineral that helps to regulate muscle and nerve function. In normal circumstances, the kidneys work to filter excess potassium out of the body. But in people with chronic kidney disease, the kidneys are unable to do so. As a result, consuming high potassium foods such as avocados can lead to dangerous levels of potassium accumulation in the body. According to a recent scientific study published in the Journal of Renal Nutrition in 2020, researchers found that the consumption of high potassium foods like avocados increased the risk of hyperkalemia in people with chronic kidney disease. Another study published in the International Urology and Nephrology Journal in 2021 found that a low potassium diet helped to reduce the progression of chronic kidney disease. If you have chronic kidney disease, it's best to avoid consuming avocados and other high potassium foods. Instead, you can try incorporating low potassium fruits and vegetables into your diet, such as apples, blueberries, and green beans. Next, number 3, kiwi. Kiwis are small, nutrient-dense fruits that are rich in vitamin C, potassium, and fiber. However, they should be avoided by people with chronic kidney disease because they're also high in oxalates. Oxalates are naturally occurring substances that can form crystals and contribute to kidney stone formation. Recent scientific research in 2021 has confirmed that consuming kiwis can increase oxalate levels in the body, which can lead to the development of kidney stones and exacerbate chronic kidney disease. Therefore, people with kidney disease are advised to limit their consumption of kiwis and other high oxalate foods. It's important to note that kidney disease is a serious condition that can lead to complications if left untreated. Following a healthy diet that is low in oxalates, along with other lifestyle changes, can help manage symptoms and slow the progression of the disease. Next, number 4, oranges and orange juice. Oranges are a delicious citrus fruit rich in vitamin C and other nutrients, and orange juice is a popular beverage enjoyed by many people worldwide. However, consuming oranges and orange juice may not be suitable for people with chronic kidney disease. The high levels of potassium present in oranges and orange juice can be problematic for individuals with CKD, as their kidneys may not be able to filter excess potassium from their blood effectively. This can cause a condition called hyperkalemia, which can lead to irregular heartbeats, muscle weakness, and even heart failure. According to a 2021 study published in the International Journal of Food Sciences and Nutrition, patients with CKD should limit their potassium intake to less than 2,000 milligrams per day. A medium-sized orange contains approximately 237 milligrams of potassium, while an 8-ounce serving of orange juice contains around 496 milligrams. Thus, individuals with CKD should be cautious while consuming oranges or orange juice to prevent any potential health risks. Next, number 5, melons. Melons, including cantaloupe and honeydew, are a popular summer fruit due to their refreshing taste and high water content. However, people with chronic kidney disease should be cautious when consuming these fruits because they are high in potassium. Excess potassium in the bloodstream can be dangerous for people with impaired kidney function, as the kidneys are responsible for regulating potassium levels in the body. If potassium levels become too high, it can lead to irregular heartbeat, muscle weakness, and even paralysis. Recent studies have confirmed that limiting dietary potassium intake is essential for managing chronic kidney disease. A study published in the Journal of Renal Nutrition in 2020 found that reducing potassium intake can slow the progression of chronic kidney disease and improve overall kidney function. Another study published in the American Journal of Kidney Diseases in 2020 showed that patients with chronic kidney disease who consumed a high potassium diet had an increased risk of developing kidney failure. If you have chronic kidney disease, it's important to speak with your healthcare provider and a registered dietitian to develop a diet plan that limits potassium intake. Some lower potassium alternatives to melons include berries, grapes, and apples. Next, number 6, nectarines. Nectarines are a type of fruit that are similar to peaches but have a smooth skin. They're a good source of fiber, vitamins, and minerals, and are low in calories. However, if you have chronic kidney disease, you should avoid consuming nectarines. This is because nectarines, along with other stone fruits, contain high levels of potassium, which can be harmful to people with kidney problems. Recent scientific research published in 2021 in the Journal of Renal Nutrition supports this recommendation. The study found that a high intake of dietary potassium can increase the risk of developing kidney disease and accelerate the progression of the disease in those who already have it. Therefore, people with chronic kidney disease are advised to limit their intake of potassium-rich foods, including nectarines. It's important to note that not everyone with kidney disease needs to avoid nectarines completely. The level of potassium restriction depends on the severity of the disease and other individual factors. It's always best to consult with a healthcare professional or a registered dietitian to determine the appropriate dietary restrictions for your specific case. Next, number 7, apricots. Apricots are a popular fruit known for their sweet and juicy flesh. However, they should be avoided by people with chronic kidney disease. Apricots contain high levels of potassium, which is a mineral that can be harmful to individuals with CKD. When kidneys are not functioning properly, they are unable to remove excess potassium from the body, leading to a buildup that can cause heart problems and even death. Recent scientific research in 2021 has further confirmed the dangers of consuming apricots for those with CKD. A study published in the Journal of Renal Nutrition found that apricot intake was positively correlated with higher serum potassium levels in patients with stage 3 and 4 CKD. The study recommends that patients with CKD should limit their intake of apricots and other high potassium fruits to avoid potentially life-threatening complications. Before we reveal the final fruit that those with chronic kidney disease should avoid, we want to ask you for a quick favor. If you found this information helpful so far, please consider giving this video a thumbs up. Your support helps us to reach more people who can benefit from this content. Now, without further ado, the 8th fruit that those with chronic kidney disease should avoid is prunes and prune juice. Prunes, also known as dried plums, are a type of fruit that are rich in fiber, vitamins, and minerals. Prune juice, which is made from the juice of prunes, is often touted as a natural remedy for constipation and other digestive issues. However, if you have chronic kidney disease, you should avoid consuming prunes or prune juice. This is because prunes and prune juice contain high levels of potassium, which can be harmful to people with kidney problems. In fact, according to a study published in the American Journal of Kidney Diseases in 2017, a single serving of prune juice can contain as much as 700 milligrams of potassium. This is more than 20% of the daily recommended intake for people with kidney disease. Another study published in the Clinical Journal of the American Society of Nephrology in 2020 found that consuming high levels of dietary potassium was associated with an increased risk of kidney function decline in people with chronic kidney disease. While prunes and prune juice can be a healthy addition to most people's diets, they should be avoided if you have chronic kidney disease due to their high potassium content. That's all for today's video about the fruits that those with chronic kidney disease should avoid. We hope that you found this information helpful and informative. Remember, if you have kidney disease, it's important to talk to your doctor or a registered dietitian to determine the best diet for your health needs. If you enjoyed this video, don't forget to give it a thumbs up and hit the subscribe button for more health-related content. Also, feel free to leave a comment below and let us know if there are any other topics you'd like us to cover in the future. Thank you for watching, and we'll see you in the next video.